Okay, so I'm going to knock on the door and I'm going to wash my hands. I'm going to introduce myself. Hi, my name is Nicole. I am a nursing student. I'm going to be doing a physical assessment today, if that's okay with you. Okay, so I'm gonna first identify my patient by asking what's your name and what's your date of birth, and I'm going to check the wristband to make sure that those are the same and that checks out. Okay, so next I'm going to start by asking the patient a couple of questions. I'm going to ask what month is it, and then do you know where you are now, and do you know why you were in the hospital? Okay, so I would say that my patient is alert and oriented ×3. Next, I am going to assess my patient's eyes. I am going to start by checking if my patient's eyes are dilated. So my patient has eyes 5 dilated. I'm going to pass the light through, and I'm going to say that it is a brisk 4. I'm going to do that on the same thing on the other eye, 5 dilated with a brisk 4. And then I'm going to ask my patient to stare at the tip of my pen as I go towards their forehead. Okay, so my patient's eyes, pupils are equal, round, and reactive to light and accommodation. I am next going to check my patient's ears. I'm going to check the skin. I'm going to check for any drainage or discharge. I'm going to pinch the turgor of my patient's ears. Again, I'm going to do that bilaterally. Again, checking the skin and for any drainage. And then I'm going to assess inside my patient's mouth. I'm going to be checking the mucosa. I'm going to be checking the patient's teeth to see if they have any missing teeth. I'm going to check the patient's tongue, the patient's uvula, the patient's throat. I'm also going to be assessing the patient's lips and the skin around their mouth for any dryness or cracks or any discoloration. I'm going to ask my patient if they have been experiencing any headaches, vision changes, ear aches, mouth pain, or difficulty swallowing, or even throat pain. And then I am going to auscultate the patient's heart. Okay, and I am going to start at my patient's right side of the chest at the second intercostal space. And this is going to be the aortic position. And then I'm going to go to the left side of the chest at the second intercostal space for the palmatic position, the third intercostal space for ergs, the fourth intercostal space for the tricuspid, and then I'm going to go to the fifth intercostal space at the mid-clavicular line for the mitral position. And then I'm going to assess my patient's lungs. I'm going to start underneath the clavicle at the first intercostal space, starting at the right side of the chest at 1, 2, 2, 3, 4, 4, and then I am going to check my patient's lateral side for the 5th. And then I'm also going to assess my patient's lung sounds posteriorly. I'm going to ask my patient if they have been experiencing any chest pain, any cough, or shortness of breath. And then I am going to assess my patient's abdominal region. I'm going to auscultate first. starting at the right lower quadrant, and then moving clockwise to the right upper quadrant, to the left upper quadrant, and to the left lower quadrant. And then I am going to do the same thing with palpating. I'm going to palpate in the right lower quadrant, the right upper quadrant, the left upper quadrant, and the left lower quadrant. I'm going to be assessing for any distension or tenderness, or if the patient has any abdominal pain. Next, I am going to assess the patient's genitalia area, and I'm going to be checking and assessing for any skin lesions, any skin breakdown, if there's any discharge. The patient may or may not need to be cleaned. Everything looks good. I am then going to ask my patient if they have experienced any nausea, constipation, diarrhea, any abdominal pain, or any urinary issues. Okay, and then next I'm going to check the upper limbs of the skin for my patient. I'm going to be checking the limbs, the chest, the abdominal, both limbs for any skin breakdown or lesions or wounds or discoloration. I'm also going to assess the skin posteriorly. I'm going to pinch the underneath the patient's clavicle for the pinch the turgor for any signs of dehydration. I am also going to do capillary refill on my patient's fingers, and I'm going to do that bilaterally. I'm going to state that the capillary refill was less than 3 seconds. I'm going to also check the radial pulse on both sides bilaterally at the same time. I'm going to be checking for the rate and the rhythm and the quality. I'm going to assess this on the 3+ point scale. And then I'm going to do the lower extremities of assessing the patient's skin. Yes, I'm going to look for any wounds, skin breakdown, any scars, any lesions or skin discoloration. I'm going to check the patient's bottom limbs for any edema. I'm going to do that bilaterally. I am also going to check the patient's posterior tibial pulse on both sides bilaterally at the same time. Again, I'm going to be assessing for rate, rhythm, and quality. I'm going to do the dorsalis pedis pulse on both feet bilaterally at the same time, assessing for the rate, the rhythm, and the quality. I'm going to assess this on the 3-point scale. I am also going to do capillary refill on each of the toes, and I'm going to do that bilaterally on both feet. I'm going to say that my patient's capillary refill was less than 3 seconds. I am then going to do range of motion. I'm going to have the patient do flexion, extension, abduction, adduction, and then circumduction. And I'm gonna do that on each limb for my patient. I'm also going to assess my patient's skin on the lower limbs posteriorly as well. And then I'm going to do muscle strength with my patient, starting up with the upper limbs. I'm gonna ask the patient to squeeze my fingers. I'm going to ask the patient to push up on my palms and to push down on my palms. And then I am going to do the lower extremities, where I'm going to have the patient push down on his feet and push up forward with his feet against my hands. Okay, so I have assessed my patient's vital signs and they are all within normal limits, and I have completed my physical assessment, and I will ask the patient if they need anything else.